And welcome into this edition of Community in Action for the month of December 2025. I'm Jason Parent with Community Action in Aroostook, Washington, and Hancock counties. Welcome into this special edition of Community in Action for December of 2025, where we're going to look at just that, the changes that are happening in community action across the three counties, Aroostook and in Down East Maine. We're going to talk about the changes and how what was two community action agencies is now folding together under one, and how the programs and services being delivered by the people in each of the counties continues to remain viable and strong. That's the topic of this month's Community in Action. But before we get to our feature interview and bring in some of the leadership team members from Community Action in Aroostook, Washington, and Hancock counties, we're first going to get to the news and information that you can use this for the month of December 2025. And we begin with that, with this right here, something that's a little bit fun, but also a great cause, and that's Pizzas for a Purpose. The Maple Pig Bar and Grill in Presque Isle is proud to support local households with unmet fuel needs. We've done a lot of conversation in the last few months about those unmet fuel needs here in Aroostook, Washington, and Hancock counties. This is a fundraiser that's special for Aroostook County, and through the 31st of December, through the end of this year, Maple Pig will be donating $2 directly to the heating assistance programs for community action in Aroostook, Washington, and Hancock counties, specifically for the Aroostook County Fund. So that's whether you do it in-house and you eat there at the Maple Pig, dine in, or you order out. Every pizza is truly making a difference. So help us make an impact, one 16-inch pizza at a time. That's at the Maple Pig. You see the telephone number there, or you can order online at mainmaplepig.com. Again, our thanks to the Maple Pig for donating $2 for every 16-inch pizza to this very important cause to provide emergency fuel assistance for the people of Aroostook County. We also wanted to let folks know that some great developments have happened in the Home Energy Assistance Program. We were notified by Senator Susan Collins' office that funding has been released for the Home Energy Assistance Program into the state of Maine and to states all across the country. In addition to that, the Energy Crisis Intervention Program, which is for emergency fuel assistance, has been opened up. It opened up as effective on December 3rd, and so that program is now available to participating Home Energy Assistance Program members and those who qualify for the program. If you think you might qualify for the Home Energy Assistance Program, please do give us a call here at 768-3053 across any of the three counties. You can reach us at that number, or you can email us at energy@acap-me.org. You see the income qualification guidelines there on your screen. You can also apply online. There's a QR code there, or you can go to ecos.mainhousing.org and apply online for any of the three counties, and that application will get to us and will be processed likely quicker as a result. You can also upload your documents right there on that website at ecos.mainhousing.org. We encourage any household that think that they might be eligible for the Home Energy Assistance Program in Aroostook, Washington, or Hancock counties to please consider applying either online or giving us a call today for an appointment. We also want to acknowledge that ACAP's workforce development team, which covers all of Aroostook County, a small part of the northern part of Penobscot County, and up to Calais in northern Washington County, is available to provide services for adults, for dislocated workers, and through Maine's Workforce Collaborative does a number of trainings and workshops. They also allow for on-the-job training programs and youth career exploration and youth extended learning opportunities. We encourage us, if you are looking to get into employment or to gain greater employment, to give our workforce development team here a call at 768-3721, or you can email us at info@acap-me.org. That's again the Workforce Development Program serving Aroostook, Northern Washington, and Northern Penobscot counties. Our team is also reminding you here, those that do our health insurance navigation, is reminding you that there is still time to enroll for health insurance that would start effective January 1st. You must do that by December 15th. If you do it after December 15th, you can gain coverage for February 1st. The deadline to enroll in the open enrollment period is in fact January 15th. So if you have not done so already, please go to coverme.gov or give us a call here at Community Action in Aroostook, Washington, and Hancock counties. We can assist customers in any of the three counties in applying and going online and being navigated through that process by a health insurance navigator here at our agency, again, working in Aroostook, Washington, and Hancock counties. We're also reminding folks that we do provide aging services, specifically in Hancock and Washington counties. These include our adult day service facility, which is located, it's called Friendship Cottage, and it's located in Blue Hill, Maine, where we offer certified medication aids, some group activities, nutritious meals and snacks, and referral to support services and transportation as needed. And we are encouraging folks that if you are finding yourselves in a position where you're a senior and you are looking and are facing challenges around living independently, please do consider giving us a call. The number for the Aging Services Program in Washington and Hancock County to reach them directly is 374-5612. Again, that's Aging and Services in Washington and Hancock counties. We are also looking for volunteers needed to participate in Presque Isle for this year, but hopefully expanding to Hancock and Washington counties next year for Volunteer Tax Assistance Program. We are looking for greeters and tax preparers. Hours are flexible, the training is free, and the time commitment is up to what you can do. If you have any questions or want more information or would like to sign up as a volunteer, you can email us at tax@acap-me.org, or you can call us at 764-3721, extension 200 or 129. We look forward to hearing from you. We are in need of volunteers to support this year's tax season, which gets underway early in the new year. And if you haven't heard something in this broadcast and you are in need of something, whether it's employment related, housing, applying, assistance in applying for benefits, food and wellness, connecting to resources, early care and education, or any other services, please do give us a call. We have navigators who can assist you and your family or household with connecting with those needs, whether we have those programs and services within Community Action in Aroostook, Washington, and Hancock counties, or whether we can refer you and connect you with some of our partner fellow social service and health organizations working across the three counties to make life better. Again, please do give us a call if you are in need of something and aren't quite sure where to turn to at this time. 764-3721 or info@acap-me.org. And that's this week's or this month's news and information you can use again for December 2025. And as I noted at the top of this month's Community in Action broadcast, we're joined by 4 leaders here at Community Action in Aroostook, Washington, and Hancock counties who are helping to guide the agency from 1 county to 3 counties and working collaboratively across the borders of Aroostook, Washington, and Hancock counties. I'm so pleased to be joined by our 2 Chief Program Officers, Heidi Ratcliffe and Megan Barnes. Thank you both for joining me. And then 2 new positions that we have here at the agency to lead our work in Aroostook, Washington, and Hancock counties and across programs. Amy Murchison, who's Aroostook County based, and Tracy Collins, who's leading our efforts down east as our 2 directors of operations. Welcome, ladies. Thank you all so much for joining us as we provide this overview to our community across the 3 counties of what we're up to and how we're bringing together 3 counties into 1 agency. So thank you very much for being with me.
Thank you.
Well, we're going to get right down to it and talk about where and share with you what are some important activities and things to note that we've been working on to bring into being 1 community action agency for 3 counties. And so I'll lead us off in that conversation by sharing with you these following things. Contrary to what folks have been talking about specifically and hearing about in the media, this is not a merger between Aroostook County Action Program and Down East Community Partners, which was the community action agency serving Washington and Hancock counties. Rather, what this is really the transition of contracts for Washington and Hancock counties to the entity that is currently known as Aroostook County Action Program and the legal entity that is ACAP. So as a result of bringing those contracts all under 1 entity serving all 3 counties, the agency has gone from 144 team members that were Aroostook County primarily based to 210 team members that work across the geography of the 3 counties in 1 comprehensive team delivering services that we're going to talk about here in just a little bit. Now, altogether, the 3 counties here in the state of Maine, Aroostook, Washington, and Hancock, do cover about 35% of the state's landmass. So just a little bit over a third of the state of Maine, or the geography of the state of Maine, is included in this new community action agency territory. And we're working right now to form a new three-county community action agency, bringing those team members together, bringing together, which we'll do in early 2026, a new board representative of all three counties, which will be seated in that first quarter of 2026, we anticipate. And then lastly, what folks will begin to see as we move through 2026, probably about midway through 2026, is a new agency name and brand that will reflect more the fact that we are a three-county agency and are working to serve Aroostook, Washington, and Hancock counties. So that's a high-level overview of some of the current activity that we're working on. I'm going to bring in my colleagues now because as we have done that, we've assumed some new programs that folks in Aroostook County might not have been familiar with, or that folks in Washington and Hancock counties may not have those services directly in the area. So we're going to go over what some of those programs and services are now to be able to help delineate where they are offered and what the basic operations of those services are. And so we're going to begin with one service that is offered across all three counties with some variations, and that's our early care and education services. And for that, Megan, I'm going to toss it to you.
Thank you, Jason. We provide early care and education services for children and families that have young children ages 6 weeks up to a kindergarten age. Early care and education provides comprehensive and affordable, high-quality prenatal, infant, toddler, and preschool education and child development programs across all three counties. As far as Deer Isle, Stonington, up to Fort Kent. So it's a large mass area, a landmass area that provides these services. Currently, we have the grant that serves Aroostook County in many locations that we'll talk about, as well as we were named by the federal government interim oversight for Hancock and Washington County to be able to provide these services. When we do a quick breakdown of the services and slots that we have available within the three counties, we provide services for 6 weeks to 3 years of age. We have 70 early Head Start slots. We have almost 250 Head Start, which serves 3 to 5-year-olds, whether it's in partnership with public schools or their standalone centers. And we also provide over almost 350 childcare opportunities for children and families that need those extended day care.
Great. So now Heidi Ratcliffe, complementary to that we do offer programs of a similar nature across the three counties are the portfolio of energy and housing programs, which are pretty consistent across Aroostook, Washington, and Hancock counties. Talk about those and what folks can expect from their community action agency related to energy and housing.
Absolutely. So our energy and housing programs do cover all three of the counties. It focuses on resources to help individuals stay safe and warm in their homes. Many individuals utilize our heating assistance program. Between the three communities, we're looking at serving over 10,000 households between our energy service programs alone, not counting our housing services that we provide, including repairs and furnace replacements and things of that nature. We offer education assistance in other areas as well as energy efficiency. And we're looking forward to having our new contracts come through after the government shutdown so we can start initiating that program back up. And again, we have a lot of coaches that are anticipating and anxiously waiting to be able to provide those services to our communities.
Now, Amy Murchison is Director of Operations and certainly starting here in Aroostook County with your work here and you working very closely with Tracy Collins, who's going to speak about our aging services in just a bit. The coaching in particular and workforce services are ones that we've offered here in Aroostook County and actually did some work with the Forerunner Community Action Agency in Down East as it relates to Down East Community Partners and to support them in getting their coaching program off the ground. Now we're really looking at a comprehensive coaching program across all three counties.
Yes, Jason. So we are offering coaching across three counties, including supporting customers in accessing workforce initiative programs. Coaching really works with our customers to overcome challenges, barriers, identify pathways to achieving their goals, whether it's education, workforce, family goals, and provide those supports, find those resources in those local communities. So we're very excited to be offering coaching, having coaching from Fort Kent to Ellsworth and sprinkled in between.
All right. Now, similarly, or dissimilarly, I should say, in this particular case, Tracy Collins, Aging Services is something that the organization that you worked with prior to, Down East Community Partners, has long since provided to the community members of Washington and Hancock counties with specific attention, in this case, to Hancock County. Talk about the aging services that are offered to the folks in Washington and Hancock counties.
Thank you, Jason. Friendship Cottage is an adult day service in Blue Hill that offers a safe place for older residents with day services for a day treatment for medication management, personal hygiene assistance, and social activities. It provides a way to keep seniors engaged and connected to the community and operates Monday through Friday.
Well, awesome. So this is a service that folks in Aroostook County, I just want to be clear, those are offered here locally in Aroostook County by a partner agency, Aroostook Agency on Aging. But if you are in Hancock County in particular, with the opportunity to be able to participate in the day services at Friendship Cottage, we certainly would love for you to reach out and to talk to us about those options and opportunities. And lastly, Heidi Ratcliffe, this is sort of the reverse of that, where prevention and wellness programs are primarily programs offered in Aroostook County, and we would acknowledge that the partner organization that offers those services in Washington and Hancock counties is known as Healthy Acadia, and we've developed a good working relationship and partnership with them. But talk about the services in prevention and wellness that we offer here in Aroostook County.
Absolutely. So our prevention services focus on a couple of different varieties or domains of nutrition, oral health, substance use, tobacco, obesity, and youth engagement. All of those contracts are provided in Aroostook County and some touching Northern Washington. As mentioned previously, even if we do not provide those services in Washington and Hancock, we do have a partner that we can ensure our customers that are needing those resources are able to utilize through that partner organization. And it's just fine-tuning those areas of which areas we provide those direct contracts to and which areas our partners serve in those locations.
Excellent. Now, speaking of locations, obviously with the 3-county coverage area, we want to be in connection with people and meet them where they are at and closer to their home for their services. And so we're going to put up a map now that shows you where locations of services delivered by Community Action in Aroostook, Washington, and Hancock counties is offered. And I'm going to begin by sharing with you that we have 3 what we call comprehensive customer service centers across the 3-county regions. Of course, for those of you living in Aroostook County, you're very familiar with the Aroostook County Action Program historic location that has been here for a number of years, over 3 decades now, next to Walmart. That's the customer service center in Presque Isle, again, right next to Walmart and Tim Hortons right here on Main Street in Presque Isle. In addition to that, we have a relatively comprehensive customer service center in Houlton where you can access or have access to all of our programs and services through both a customer service center there that also has an early care and education, a comprehensive facility located right there in that facility. And then lastly, our new comprehensive service center serving Hancock and Washington counties and specifically located in Hancock counties is in Ellsworth at Avery Lane, at 18 Avery Lane, where very similar to Houlton, there's an early care and education center adjacent and right in the same property as our comprehensive customer service center. But Heidi Ratcliffe, there are other locations where you can connect with our services in more of an office setting, and I'll let you go through those.
Absolutely. So to cover the little briefcases that you see, we do have an office location in our Madawaska location, our Calais location, which is directly in the town office, and then we're finalizing our last location in our Machias area right now. I would also bring to your attention our little mobile service unit, which is kind of in between the counties, and just to kind of square that up, I'm hoping that if you're from Aroostook County, you would have seen our RV moving around, going to different locations that we do not have center locations in, to be able to bring those services and programs specifically to your area. And we're looking forward to the transition coming this spring to bring that down to Washington and Hancock. So the communities and the households there are able to utilize services on the RV at that point.
And Heidi, while I have you and while you're still talking, before I turn it over to Megan to talk about where we're located as it relates to early care and education, including the public school partnerships, tell me about the housing icon and those 2 unique identifiers in the 2 communities that they're designated there.
Absolutely. So the little housing parts that you see, one will be our Norman L. Fournier Place for residents here right in Presque Isle. And then the one on the southern border is our Friendship Cottage, which is in Blue Hill.
Which Tracy Collins just talked about a minute ago. And Megan Barnes, let's talk about now the apples. I mentioned the comprehensive customer service centers in Holton and in Ellsworth that have early care and education right there on site. But there are quite a few more apples on the map here. So talk about where the early care and education, what we consider centers, are located, and then our public school partnership overview.
Absolutely. Thank you, Jason. We have from one end of the state to the other, as you can see where the apples are located, we have a center in Fort Kent that houses children from 6 weeks to 5 years of age. We have an additional center in Caribou that serves early Head Start, 6 weeks to 3 years of age, as well as preschool services. We have a center in Presque Isle that has, in addition to the other services that I've already mentioned, that we also have a school age program there that supports children after school and on school vacations. We have a center in Holton, as mentioned. We also have a center in St. Croix in Calais. That serves young children 6 weeks to 5 years of age, as well as Machias. And then in our Ellsworth location, we serve children from 6 weeks to 5 years of age. We also have a number of public preschool partnerships that provide comprehensive services and this includes accessing coaching services in our Caribou, with Caribou Community School or RSU 39, with our Limestone Public School. We also have one in Presque Isle. We have one in our Holton location. We have an additional one in Deer Isle, Stonington, as well as in Ellsworth and Bucksport. And I think I've hit them all.
All right. Yes, indeed. And so certainly the message there is very clear that we are very close to where we serve people across the counties, whether it's across using the mobile service unit to go to some of the more rural communities where we don't have that physical presence that we indicated in the office locations or partnership locations with public schools or our own bricks and mortar buildings for early care and education. But in addition to that, and as Heidi Ratcliffe can certainly attest, we do have members of our teams out and about in the community, whether that's our housing team members in people's physical homes where they're working across the 3 counties to do assessments and to get weatherization and home repair work done. Or whether it's our prevention team members in Aroostook and Northern Washington County, being in public school settings and other locations and community gatherings to help educate the community. So we're really, the message there is that our programs and services, we do our best to bring them to folks and meet folks where they are at with those programs and services. So now we're going to move on to talk just briefly about the governance, because I think this is a critically important component as we transition to a 3-county organization. Historically, Aroostook County Action Program has had a board of directors that has been comprised solely of individuals living and working and otherwise being here in Aroostook County. And our goal really with this is to expand that footprint similarly to the board of directors to include board of directors from other counties, from Washington and Hancock counties. We did a work session to listen to the needs of community members in early November in Millinocket, where we got great feedback on what is needed from their community action agency and how we can best ensure that from a governance and organizational perspective. But we are committed to having representation, which we will begin early in 2026 from all 3 counties on the board of directors of community action in Aroostook, Washington, and Hancock counties. And then we will be working on finalizing the revised bylaws, which are currently in draft form for the new organization that serves 3 counties that will specify and make provisions for board directors coming from all three counties. So that coming as well in early 2026. Now, community action agencies, as Heidi Ratcliffe, who oversees the work that we do as it relates to what's called the Community Services Block Grant, can talk to you a little bit about the process of what's called the Community Needs Assessment and how we've come to identify what the needs are across the three counties. So Heidi, talk to us a little bit about, I just mentioned we were being responsive by having community leaders come together, but there's an even more formal process called the Community Needs Assessment with Community Action, and we'll go over some of the results of that most recent one.
Yeah, so I think the community needs assessment is incredibly important to the work we do because it's the customers' voices why we exist, and to create programming and services that are literally going to be impactful to the community. So our community needs assessment that is done every couple of years really tells us where we need to focus our energy and efforts on. And so we will have lots of things like focus groups and surveys and all of this data gathered together to really tell us where we need to go and what type of programming we need to provide to the community, which is really important. So we really try to make sure the customer's voice is heard, and we take that into consideration as we continue the future of our agency and what that means for services we provide.
So let's take a look and do a snapshot of what some of the top needs addressed in the most recent Community Needs Assessment, Heidi, are, which was just released earlier this summer.
Yes, thanks, Jason. So for Aroostook County, community conditions typically stay the same. We did have transportation and housing as one of the top two that seem to be consistent year after year. One of the new ones for us is available providers. Certainly being in a rural area, we know that that is a challenge to be able to access medical providers, especially specialists. So those are our top three areas for Aroostook County. Protective factors and risk factors, drug use, nutrition, cancer prevention. So we did have a lot of medical issues come through as to needs that we need to focus on. Health conditions and outcomes. Again, mental health was a big concern for Aroostook County. Cardiovascular disease was one that was rare to Aroostook County compared to the rest of the state. And as well as obesity and weight status was another one that was specific to our Aroostook County alone. In Washington, conditions were transportation, poverty, housing, and again, available providers. Similar to Aroostook County for Washington, illicit drug use, adverse childhood experiences, so also known as ACEs, and then nutrition was something to be aware of in Washington County, excuse me. And then health conditions and outcomes for Washington County, again, mental health, substance use disorder, and cancer. Lastly, Hancock County, really that one specific to them in that area was the aging related services. That community was really honing in on the need for aging related supports, housing, and again, available providers. Protective factors kind of consistently across the board, substance use, we have ACEs again in nutrition, and then health conditions and outcomes for specific to Hancock, mental health and access to long-term care. And I think that goes back to the aging elder services provided to that community. Oh, Jason, you're muted.
Now, interesting to note, thank you very much, Heidi. Now, interesting to note, and Tracy Collins, you were one of the team members that led this particular effort, is that when you look at those needs and then you do a crosswalk of them, there's actually quite a bit of similarity across the three counties, as you might imagine. So I'm going to have you talk about that and walk us through this next slide that basically shows what the needs are if you look at them county by county. So Tracy?
Across the three counties, several common needs emerged that highlights the shared priorities of community well-being. All these counties report ongoing challenges related to housing, limited availability of providers, nutrition insecurities, and access to mental health services. When comparing county pairs, additional patterns appear in Aroostook and Washington counties, both identifying cancer prevention, transportation barriers, and drugs use. Across the country, Aroostook and Hancock share elevated rates of cardiovascular disease, signaling a need for strengthening prevention and intervention efforts in both regions. Meanwhile, in Washington, Hancock counties overlap, and they're focusing on addressing adverse childhood experiences, which emphasizes the importance of early intervention and resilient building supports.
Thank you very much, Tracy. I think it's important to note here that even though some of those things aren't showing up in other counties, that just means that they weren't ranking at the top of the list, but certainly by no means aren't needs in those three counties. That ACEs aren't a challenge in Aroostook County, or substance use obviously is certainly not the case. So we just want to qualify that to an extent that this was just the results of what the agency or what the community needs assessment demonstrated as the highest of the high in terms of needs. So as we move forward at the agency level, Amy, we're looking at some goals and priorities that emanate in part from that community needs assessment, but also in reflection of the moment in time that we're at as an agency where we're bringing together services and team members from three counties. So I'm going to ask you to walk us through, if you would, what our 2026 goals and priorities are, Amy, as it relates to those things that are more internal facing to us as an organization, and how we are going to be able to better support our community as a result of taking care of and paying attention to these things.
Yes, Jason. So as you can see, our goals and priorities for 2026 are really continuing to explore opportunities to collaborate and partner in communities across the three counties, that we're joining community events so that we can build understanding and trust of what our three county community action agency is all about and get our faces and our names out there. So our customers and our residents of all of our communities know us. Increase our internal staff understanding of agency programs, our policies, our core values. As we talked about in an earlier slide, we have increased the number of staff who now work for the agency and really want to support them in coming together as a whole. We're also going to look at, revisit, and refine our agency mission statement. This mission statement is about 5 years old, and a lot has changed in the last 5 years. So it's a really great time to look at that and really make sure that our mission statement reflects as an agency what we're doing in the community. We're also going to develop a three-county community action 5-year strategic plan. So based on those community needs assessments, really look at the community needs across the three counties and build our strategic plan for the next couple of years.
Thank you, Amy. Now, in the last segment of our time together in our conversation, we did set, and as Amy noted, we're going to be working toward a longer 5-year strategic plan. But our management team did get together this fall, and working in collaboration and in review of our board of directors has set some 2026 goals and priorities in terms of how we engage at the community and at the family level in various areas that you just saw up here in the community needs assessment. And so we're going to ask Heidi and Megan to walk us through different components of that those particular goals and priorities as it relates to our programs and service deliverables in 2026. So Heidi, let's start with you in an area that isn't traditionally, at least not in Aroostook County, and historically was a part of community action in Down East, and certainly appeared very prominent across the three counties, and that's challenges as it relates to transportation.
Yeah, transportation always seems to be one that is pretty important to many communities, and especially to Aroostook County, as we have such a large geographic area across all three counties, actually. So it's really important that when we're working on strategic plans, that it's not always us as the direct provider to be meeting that need, but to work in partnership with agencies that also provide this. So in regards to transportation, we know that we're going to work really hard with the current provider, ARTS. We have ARTS in Aroostook County and providers down east as well, but collaborate and make sure that our customers that are utilizing are aware of that service and how to have that be more accessible. Use it between cross programs, our workforce customers, and seeing if we're able to support each other using that service to ensure that we continue to have the transportation services that we do have in the areas. We want to expand the mobile service unit as discussed earlier. So to date, the mobile service unit has been active in Aroostook County, but we need to get it down to Washington and Hancock, which we're looking forward to doing that into 26 next year as that comes around. The last one is increase volunteer drivers. We know that there's a lot of individuals who it's really important to give back their time, and you might not always need to be able to give financial assistance to be able to help support people, but can you volunteer to provide a ride to somebody? That's a huge undertapped part that we have not really expanded on and something that we're looking forward to doing in the future.
And Megan Barnes, the next area, childcare, is one that didn't appear in a top 5 in terms of needs, but certainly from the perspective of the work that we do and the work that we engage businesses in, we understand that childcare is a huge need in the area. And so it's a priority level goal for us in 2026 and certainly beyond that. Talk to us about what we hope to accomplish and what we're setting our sights on in 2026 as it relates to childcare.
Absolutely, thank you. So childcare is so, like you stated, so very important to all workforce and all industries in our communities. Without access to high quality childcare services, and this includes Head Start and Early Head Start and partnership program services, people aren't able to go to work. People aren't able to contribute and really support their communities. So one of our first areas to focus on is securing the Head Start 5-year grant for Washington and Hancock County. As I stated previously, we are at an interim status currently. We recently found out that this will extend long into 2026. But in the meantime, we're working very diligently to write and be ready for the proposal to go out and apply for consideration to hold that grant for those 2 additional counties. The second area that we're looking at is growing the workforce through partnerships to really be able to provide those high quality services that encompass childcare and early care and education services within the 3 counties. We do this through internships, through our partnerships with CTE programs across the state, as well as really support and partner with public community colleges, as well as the universities in the respective areas that we provide services. Really get people hands-on experience within this field to really see engage if this is the right choice for their careers. And the last and final area that we're really going to focus on is increasing or expanding the number of public school partnerships by at least 2 within the 3 counties. We are well underway in this area. We've had ongoing discussions with local communities, their public schools, engage their interests around providing those comprehensive services that encompass early care and education in a public school setting. We're trying to get away from those bricks and mortars, standalone centers. We know that in our previous work with our current partnerships, that together Head Start programming, early childhood education programming, and public school programming makes greatness, really focuses on school readiness and preparing families for what to expect with their young child as they progress through their school years. So those are the areas that we're really having a huge lift on in this next year.
Great. Thank you so much, Megan. And Heidi, back to now housing and energy and need that was clear across the 3 counties. What are our intended goals as it relates to 2026?
So one of the bigger pieces is when we added Washington and Hancock as a coverage area, we need to ensure that we are implementing best practices across all 3 counties. So there were some great takeaways that Washington and Hancock County had from their energy team and different processes that we provide here in Aroostook County. So ensuring that we're taking the best practices of all 3 and creating one solid program to provide the best energy service that we can across those 3 coverage areas. We wanted to continue to standardize the process, but also we need to reclaim and restart our housing support services that we provide in Washington and Hancock. That has not been staffed, so we need to find staff, get them trained up so we can be able to provide those home repair and weatherization services to Washington and Hancock counties as well. Our aging services, it was really important for us that we secure a facility and demonstrate and that we can continue to provide this service that is so needed in this community. This is a new coverage area for us. We haven't been an organization that has typically provided solo agents, elder services. And so we do need to find and make sure that this is a service we can continue to offer and potentially expand and grow. We also want to start pursuing grant opportunities to fill the gaps in funding so that we can continue this important service.
And also moving on to prevention and wellness and our goals as it relates to that.
Yeah, so prevention and wellness, we want to make sure that we spend time exploring and collaborating with the partners that provide those prevention services in Washington and Hancock. So Healthy Acadia is the provider down there, whereas in Aroostook, we provide all of the prevention services as mentioned previously. We need to make sure that we're doing our best energy, putting forth how do we ensure that our customers in those areas are getting that same level of support that they would be in Aroostook. And we know that that's easily possible. It's just not going to be done by us. So it's a little bit of a different practice, but looking forward to expanding that partnership with Healthy Acadia specific in regards to prevention and wellness.
And lastly, in coaching and intake.
And lastly, coaching and intake. We, as an agency, started an intake process that we are in a 2.0 at this point, really excited about expanding, trying to reduce the amount of times individuals come into our organization and share their story. So we are making it easy and accessible to access our services. We need to ensure that we're providing that same support and same service down in Washington and Hancock. So making sure that people coming in complete the assessments in all three areas, referrals are done, eligibility is done for all customers, regardless of what county you're entering in. Same thing with coaching. We had coaching contracts in which different services were provided. They were same verdict, same way to get to the end of the road, but different ways to get there. And so standardizing our coaching programs to be able to offer, again, consistency across all three counties is going to be super important for us. It's pausing, taking an assessment of what we do really well and making sure that we mimic that across the three counties.
Right. Well, thank you very much, Heidi Ratcliffe, Megan Barnes, Tracy Collins, and Amy Murchison. We've covered a lot of ground. There's certainly a lot happening as we transition and we adopt a three-county model here in community action across northern and down East Maine. And certainly the work that the four of you are doing to lead those initiatives is very much appreciated. And thank you for spending the time to help explain to our community in this vehicle, in this venue, where we are at with that. Before we leave you and before we leave all of you watching us, we're going to turn to our highlight snapshot for the month of December 2025 here on Community in Action. And our highlight snapshot takes us to the University of Maine at Presque Isle this month, where community educators in our prevention program in Aroostook County, Megan Lakem and Brittany Montgomery, joined with students there at UMPI to raise awareness for the Great American Smokeout about the importance of quitting smoking and the dangers of vaping. We thank our community educators and our partners at the University of Maine at Presque Isle for this worthwhile community outreach and just a reminder of the work that we're doing out in the community each and every day. That's this month's edition of Community in Action for December 2025. We'll see you next month and next year for our next edition. Until then, have a great month, everyone, and happy holidays on behalf of our board of directors and our entire team at Community Action in Aroostook, Washington, and Hancock counties. We'll see you then.